My name's Cassie, and this is my head to toe video, and Mr. Filey's here to make sure I have no notes. Thank you. Alright, so I checked the chart before coming in. I provided for privacy. Washed my hands, and I'm going to check for 2 patient identifiers. Hi, I'm Cassie. I'm going to be your nurse today. Can you go ahead and tell me your name and date of birth?
Tiffany Miller, May 28, 1996.
Okay, and that is correct. Do you know where you are today?
I'm at Baker Hospital.
Okay, do you know why you're here?
I'm here for a checkup.
Alright, do you know who the president is?
Obama.
Alright, do you know the day today?
It is Tuesday.
Okay. Alright, and those are correct. So the patient is alert and oriented times 4, person, place, time, and situation. So patient is alert. Her dress is appropriate for the season. Her posture is erect. All body movements that I've seen so far have been intentional. No unintentional movements, no jerks or anything. Hair looks clean. She looks like she takes care of herself. So I guess first I'm going to start off with your head. So I'm going to start by inspecting your scalp and your hairs, but I'm going to ask you a couple questions. Have you ever had head trauma? Do you experience headaches?
Nope.
No. Have any history of head issues?
Nope.
No. I did not put my phone on airplane mode. Hopefully nothing happens. Alright, so I'm going to put gloves on and inspect your scalp for any masses or lesions. Alright, I'm just going to feel around. Tell me if you feel any pain. Any pain? No?
Feels good.
Alright, hair looks clean. No masses. I didn't see any lesions. No lice. Alright, so I'm going to go through a list of the cranial nerves and test those before I forget. So cranial nerve 1 is smell. So to test smell, I would have something smelly and have her close one nostril and breathe it in if this is prompted. Do you have any issues with your smelling?
Nope.
No, any changes in smelling?
Nope.
No, so we'll say cranial nerve 1 is intact. Cranial nerve 2, 3, 4, and 6 are tested by Perla and the 6 cardinal gazes, so I'm just going to go ahead and do that. So can you look at my finger? Before I start this, I'm going to measure your pupils. Pupils are about a 5. Okay, so look at my finger. I'm going to check for direct and then consensual. And each eye, sorry. Okay, so pupils are round, reactive to light. Can you look at that plan up there and then look at my light? Okay, so eyes accommodate. And I'm going to have you follow my pen light. Alright, so cranial nerves 2, 3, 4, and 6 are all intact. I'm going to go ahead and test cranial nerve 5 by first feeling her temporal mandibular joint. Go ahead and open and close. Okay. And then I'm going to do facial sensations, so go ahead and tell me if this is sharp or dull.
Dull. Dull. Dull.
Okay.
Sharp. Sharp. Sharp.
Okay. So cranial nerve 5 is intact, and I'm going to test for cranial nerve 7. So can you raise your eyebrows and puff out your cheeks? Okay, so cranial nerve 7 is intact, and can you go ahead and swing your legs on the side of the bed, and I'm going to test for cranial nerve number 8, which is hearing. So I'm going to perform the whisper test for this. So I'm going to say, so I'm going to whisper 2 words, and just go ahead and tell me what they are.
Whiteboard. Plant.
Okay, so cranial nerve 8 is intact. And I'm going to go ahead and check cranial nerves 9, 10, and 12. So, can you go ahead and stick your tongue out? Okay, can you move it side to side? Can you say ah? Okay, and can you swallow for me? Okay, and can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, so cranial nerves 9, 10, and 12 are intact. And cranial nerve 11, I'm going to check by putting a little bit of resistance on her shoulders and having her shrug. Go ahead. Okay, so cranial nerve number 11 is intact. So those are all the cranial nerves. Now I'm going to ask you a couple questions about your eyes. Do you ever have eye pain?
No.
No. Any history of glaucoma?
Mm-mm.
Any history of glaucoma in your family?
No.
No. Do you wear contacts or glasses?
Mm-mm.
No. Any history of cataracts?
No.
No. Okay. So, and I already checked her eyes by doing Perla. Her eyebrow, the hair on her eyebrows and her eyelashes are distributed equally. I'm just going to pull down and up on your eyelids. Alright, conjunctiva is pink and moist. I didn't see any opacities in her eyes. They look symmetrical. Next, I'm going to ask you a couple of questions about your nose. Do you ever get sinus infections?
Mm-mm.
No. Have any difficulty smelling?
No.
No. Any nosebleeds?
No.
No. I'm trying to think of questions. I'm gonna go ahead and feel your sinuses. Go ahead and tell me if you feel any pain. You'll probably feel a little bit of pressure. Any pain?
No.
No? Okay. And I'm going to look up your nose for any perforations. Alright. The hair in the nose is intact, distributed evenly. Didn't notice any deviations or perforated septum. Nares are equal on both sides. Look fine. Nose is patent. Next, I'm going to look at your ears. Do you ever get ear infections?
No.
No. Any hearing loss?
No.
No. Any ringing in your ears?
Mm-mm.
No. Any ear pain?
Nope.
No. Any like fogginess?
Mm-mm.
No. Okay. All right. So I'm gonna look in your ears just to check for drainage. I don't see any drainage in that one. Just some cerumen. Right, and same for that one. And next, I'm going to pull on the. I'm going to do them at the same time. On the pinna, the tragus, and the auricle. I don't remember which is which, but did you have any pain?
No.
No, they felt fine. They were flexible. That's the word that I want. And then at this time, I would do a whisper test if needed. Next, I'm going to do your mouth. Her lips are pink, a little bit dry, but it's cold outside, so I'm not surprised. Do you have any mouth pain?
Nope.
No. Do you get like canker sores or cold sores?
Mm-mm.
No. Any abnormal lesions in your mouth?
Nope.
No. Any tooth pain?
Nope.
No? Okay. Any problems swallowing, talking?
Nope.
No? Okay, so I'm just gonna look inside. Go ahead and say ah. Okay. Buccal mucosa is pink and moist. Tongue is pink and moist also. Her tonsils are about a +2, which is normal. Looks fine. I'm so awkward. Next, before I forget, I'm going to check her carotid pulses. Not at the same time, because you can include them and make them pass out. In 3 different spots. My hands are full. And I'm I'm going to feel for her temporal artery too. Okay, so those are equal bilaterally. I'm going to auscultate for any carotid bruits using the bell of the stethoscope. Go ahead and take a deep breath in, exhale, and hold. Again, listening in 3 different spots. Okay, go ahead and do that again, and I'm going to do the other side. Okay, so no bruits are present, which is a good thing. I'm going to check skin turgor. None. I'm going to feel for any crepitus while I'm at it. No crepitus noted. I'm going to check for lymph nodes. I was about to forget that. So I'm going to palpate the preauricular, the postauricular, the occipital, the submental, submandibular, the tonsillar. The only ones that you could be able to feel are the tonsillar. So if you can feel any other ones or can see any other ones, there might be a problem. Go ahead and turn your head down. Yep. And I'm gonna feel for the deep cervical chain. Go ahead and look the other way, and I'm gonna feel it for on this side. Okay, and then I'm gonna feel for the superficial cervical, and posterior cervical. Go ahead and look that way. Again on this side, superficial and then the posterior. And I'm going to feel for the supraclavicular. These ones you shouldn't be able to feel, like ever. Okay, I don't feel anything. So those are the lymph nodes. I don't know where I want to start. I guess I'll do the thorax and the lungs. So I checked for crepitus. Go ahead and, do you feel any pain in here?
No.
No? Okay. Do you do self-breast examinations?
Yep.
Yes? Okay. Have you noticed any abnormal changes in your breast tissue?
Mm-mm.
No? Okay. From here, breast looks symmetrical. No, doesn't look funny or anything. So I'm going to ask you a couple questions. Do you ever get respiratory infections?
No.
No? Do you have asthma? No. Have you ever had pneumonia?
Nope.
Do you have a history of asthma in your family?
No.
No? Okay. Do you ever get short of breath?
Mm-mm.
No? Do you ever get short of breath on exertion?
No.
No? Okay. Do you take any respiratory medications?
Mm-mm.
No? Okay. How many pillows do you use to sleep at night?
Just one.
Just one? Okay. And that's good for you?
Mm-hmm.
Okay. Are you a smoker?
No.
No? Does anyone in your family smoke?
Mm-mm.
No? Okay, good. Alright, so I am going to percuss the anterior chest field, going in a Z pattern in between the intercostal spaces, avoiding any breast tissue or like bones like the sternum or anything. So my hands are a little cold. Starting up above the clavicle because the tops of the apex of the lung is up there, I believe. Tell me if you feel any pain while I'm doing this.
Okay. Of course.
Okay, all sounds are renaissance. I didn't hear any abnormal, adventitious sounds. So I am going to go ahead and auscultate. I noted her skin temperature is warm throughout her chest. Let me go ahead and check your arms real quick while I'm talking about it. So skin temperature is equal on the arms. Let's do your cap refill. cap refill on both hands is less than 3 seconds. I'm going to go ahead and feel for your brachial pulses. Okay, brachial pulses are palpable and about a +2. I'm going to go ahead and feel for the radial. Those are also palpable and about a +2. Both are equal bilaterally. So now I'm going to go ahead and listen to the lungs. I didn't want to forget those things while I was thinking about them. So using the diaphragm of the stethoscope, I'm going to just auscultate the anterior lung field, going in between the intercostal spaces again. Go ahead and take a deep breath. Again, you want to avoid any breast tissue because it can make it hard to hear. Okay, go ahead and lift up. Okay, I didn't hear any adventitious sounds. Everything was clear, no wheezes or rhonchi. I'm going to have you sit up on the side of the bed and I'm going to do a couple things on your back. First I'm going to do tactile fremitus, so every time you feel pressure with my hands, go ahead and say 99.
99, 99, 99, 99, 99.
Okay, so every time she says 99, the further I go down, the more it disappears, which is a normal finding. I'm going to do chest expansion. Go ahead and take a deep breath. Okay, so the lungs expand bilaterally. I'm going to have you stand up on the side of the bed real quick, and I'm going to check for AP diameter, which should be a 1:2 ratio. So going from the scapula to the front, so there's 1 to 2. So her AP diameter is normal. I don't think you can see that very well, but people with barrel chests, their AP diameter will not be a 1:2 ratio because their back may be larger than their side, or it's the other way. Their side is larger than their back. So I'm going to percuss your posterior lung field, again going in a Z pattern, avoiding bones like the scapula and the spine. I'm going to lift this up back. Okay, so all sounds are renaissance. I'm going to go ahead and auscultate her posterior lung field. So I need to move this a little bit. Can I have you turn around to the other side? That might be easier for, let me see what I'm doing. There we go, that's better. So the posterior lung field starts at C7, which you will feel for the second notch on her neck. So that's going to be C7. And then we're going to find the bottom of the scapula and work your way in between the intercostal spaces to T10. So that's about right here. On an inspiration, it can go all the way down to T12. And then on the side, it moves over to T8. So I'm just going to auscultate throughout that entire lung field, avoiding the scapula. Okay, go ahead. I'm going to lift this up again. Okay, so there were no adventitious sounds. Again, I was using the diaphragm of the stethoscope. That's it for lungs. I'm going to go ahead and listen to heart sounds. Do you have history of cardiac problems?
No.
Do you take any medications for your heart? No. Do you ever have chest pain?
No.
Do you have history of cardiac issues in your family?
Nope.
No. I drew a blank. I'm gonna listen. So, listening to the heart sounds, you want to use the bell of the stethoscope, and I'm going to use ape to man. So, here's the substernal notch, and I'm going to go down to, on the right side, to the second intercostal space, to the aortic. Okay, and then on the left side, again in the second intercostal space, to the pulmonic. And then down to Erb's point in the third intercostal space. Okay, and I'm going to lay you down a little bit and listen. Okay, do you want to pull up your shirt? Okay, and then the next one is in the fifth intercostal space, which is the tricuspid. Okay, and then I'm going to listen to the mitral, which is the fifth intercostal space midclavicular line. Okay, so no murmurs noted. I'm gonna check for any heaves or lifts in around this around the mitral area where the apex of the heart is. I don't know any heaves or lifts, so that's a normal finding. Do you have any history of murmurs?
Mm-mm.
No? Okay. I didn't hear anything, so I just wanted to make sure. I guess I'll check for edema. I'm going to just check for it on your arms, pushing on bony prominences. Okay, so no edema noted. I'm going to check capillary refill on her toes. Okay, capillary refill is less than 3 seconds, so that is a normal finding. I'm going to check for any edema down on her legs, again pushing on bony prominences. None noted. I'm going to go ahead and feel for her dorsalis pedis pulse. Okay, so that is about a +2, and then her posterior tibial. Which is also about a +2. Her hair is evenly distributed on her legs. I don't note any lesions. Skin temperature is equal. It's warm and dry. I'm going to go ahead and feel for her popliteal pulse. Since I found her pulse on her feet, then there should be one here. Okay. Okay. They're about a +2, so that's normal. I'm going to do sensations in your feet. All right, go ahead and close your eyes and tell me whether it's sharp or dull.
Sharp. Oh, dull.
Okay.
That's sharp.
Okay.
That's sharp.
Okay. So first, it's normal. So I guess before I have you sit up, I'll go ahead and assess your abdomen. Do you use any laxatives or stool softeners?
Mm-mm.
No. When was the last time you had a bowel movement?
Yesterday.
Yesterday. Do you take any narcotics or pain medication that could cause constipation?
Mm-mm.
No. Do you have any pain? Have you felt nauseous in the last couple days at all?
No.
No. Have you had a history of GI problems?
Nope.
No? Okay. So I'm going to go ahead and inspect her abdomen. Just going to lay you flat.
Breathing back here.
So the color of her skin is appropriate for her ethnicity, as the same throughout her whole body. I don't notice any abnormal lesions. Her contour is flat. She has a couple moles, but nothing abnormal. So first I am going to listen for any bruits in the abdomen arteries. So first I'm going to make a V with my fingers right where her umbilicus is, and I'm going to go ahead and listen to the abdominal aorta. And then I'm going to listen to the right renal artery, and then the left renal artery, and then I'm going to come down and go right across from the umbilicus to the left iliac artery, and then the right iliac artery. And then to listen to the femoral artery, you'd make a V going the bottom way of the umbilicus and listen to those, but for the purpose of this video we're not doing that. So her umbilicus is midline. It's appropriate in the right spot, so I didn't mention that earlier, and using the diaphragm of the stethoscope, I'm going to listen for bowel sounds starting in the right lower quadrant, listening in a couple different spots. Okay, so her bowel sounds are normal. They're active. They are about 5 to 30 sounds per minute. So I'm going to go ahead and do some light palpation. Go ahead and tell me if you feel any pain or tenderness. Going in a circular motion again, starting in the right lower quadrant, working my way around. Any pain?
Mm-mm.
Okay, so I'm going to go ahead and do deep palpation. Any pain or tenderness?
Mm-mm.
No? Okay. And I'd feel for bladder distension. I'm going to ask you a couple of questions on your urinary system. How often do you go pee in a day, do you think?
About 5 to 6 times.
5 to 6 times? Okay. Do you have any pain with urination?
Mm-mm.
Any frequency?
No.
Do you have a hard time getting the flow to start?
No.
No? Okay. So that's good. So before I have you sit on the side of the bed, I'm going to have you, I'm going to put my finger here and I'm going to have you move your finger from my finger to your nose back and forth.
Okay.
Okay, good. All right. So I didn't say this earlier, but to check for vision, we would use a Snellen chart or a Jaeger test if she had trouble with her vision. So you can go ahead and sit up on the side of the bed. We're gonna do reflexes.
Oh, we move that side.
I can move this probably. It's cool. Let's go down and up. Oh, dang it, that's it. Okay.
Oh, yeah, when it's good.
Tilt it this way. Okay, leave it right there. I'm going to be checking her patellar reflex. Hopefully getting a jerk in the knee.
Sorry.
Okay, and that's a normal fluent motion. Okay, same on that side. And I'm going to have you lay across the bed so I can check your Achilles. Oh shoot, I don't know where to put this. I don't know where to put it. There they are, okay.
Oh.
And now the curtain's in the way. Okay, so for the Achilles, you hit in 3 spots. You hit right on the tendon, looking for a jerk. Hers did jerk, and then on both sides of the tendon. Okay, and I'm going to go ahead and do that same thing on this foot. Okay, it jerked. Okay, so that's a normal finding. Let's try and get you back in the right spot. Okay, that should be good. I'm going to have you stand up, and we're going to do the Romberg test. Go ahead and stand there with your eyes closed for about 10 seconds. This is just checking for her balance. Balance is good. Okay, so next I'm going to have you run your heel down your shin on both legs. Okay, good. I'm going to have you lean over and I'm going to check your spine. Just making sure that her spine is straight, no scoliosis or anything, so her spine is straight and normal. Go ahead and walk in a circle for me. Okay, her gait is steady, no involuntary movements. Her range of motion is good. I've been watching it as we've been going through. She doesn't seem to have any limitations. Can you turn your head side to side? Okay, good. Do you have any questions? No? Okay, I think that's good.